wanted to take a few moments to talk about the evolution of breast implants because it really relates to today. A lot of people are talking about things like breast implant illness and are breast implants safe, and it's really hard to talk about that without talking about the history of implants. So if you go back to the very first implants, what they really were more like a hard rubber, and no one liked them because they didn't feel like a breast. They weren't soft. So what happened is they actually transitioned away from that hard, firm rubber to a more soft implant. They actually developed silicone implants with liquid silicone. So they had a silicone shell, and then they put liquid silicone on the inside. And we thought those were great because they were soft, mobile, felt like a natural breast, and everybody thought they were wonderful. The problem was these developed issues over time. That shell ruptured, and sometimes that silicone would leak out into the tissues and would cause problems. This would you'd need to have surgery to repair this. People would get increased rates of capsular contracture because of these ruptures, and as a result, it really created problems. One of the other issues that was really interesting with this is that when the silicone leaked into the tissues, it created a granulomatous reaction in the tissue. And this tissue, when you look at it under pathology, looks very similar to an autoimmune disease called sarcoidosis. Because of this, and because there were some thoughts that maybe this is autoimmune related, there was basically a moratorium on silicone breast implants because people thought, well, hey, these breast implants are causing a granulomatous reaction, and so maybe these implants are actually causing autoimmune disease. So silicone implants were actually stopped from development and completely banned in 1992. Then what happened is there were several lawsuits over that time. One of the implant companies went bank with over $1 billion in losses, and it was extensively studied over 15 years. What we learned after 15 years was that actually the breast implants are totally safe and they don't have any relation to autoimmune disease. And we know this because we can test for autoimmune disease. So we can test autoimmune disease in the general population, and then we can test it in the patients with breast implants and see if there's a significantly statistic difference. And there absolutely is not. So back in 2006, on came the scene with silicone breast implants because they are more natural than a saline and they feel much better. The next generation of implants, however, were a little bit different. They were called third generation implants, and they weren't liquid silicone because really it was the liquid leaking out that was causing the problem, hence the invention of what we call the gummy bear implant. Now, a gummy bear implant is really just a cohesive gel. What that means is that if I were to cut this implant in half right here, the insides wouldn't leak out and drip. It would just sort of stay there, just like a gummy bear. And because of that, they're much more safe, and we're not having as many problems with capsular contracture and with liquid silicone moving and things like that that we used to have with the old implants. A lot of the implant companies then sort of went another step and created more thicker gummy bear implants that had form and shapes to them, what we call form stable. Those had those teardrop implants where they had that teardrop shape, and everybody thought that was the craze. However, there were some issues with that. And what they found is that in very rare cases, some of the texturing that was used on that implant was causing a very, very rare form of lymphoma called anaplastic large cell lymphoma. Now, this is a very rare cancer and predominantly associated with a specific style of implant, a specific brand, and with a specific texturing style. Of course, we no longer make those implants, and so this really isn't a prominent issue today. But it has sort of brought up that idea that maybe, are breast implants safe? And so a lot of patients, and what's really interesting now is that a lot of patients are complaining about something called breast implant illness, where they're feeling symptoms of fatigue, tiredness, anxiety, depression, sleep disturbances. And the problem with that is that it's not an easy thing to test for. So back a generation ago, when women were feeling that there were problems with their breasts causing potential issues like autoimmune disease, we could test for that. We could test for autoimmune disease. Unfortunately, there's no test for breast implant illness because all the symptoms are vague. Again, anxiety, fatigue, sleep disturbances, and we can't really measure those things. So while we feel in the plastic surgery community that these implants are extremely safe, you're always going to find anecdotal stories of someone saying, hey, I got my breast implants and I just haven't felt right. And, who's to say that that person's not telling the truth? I mean, that is what they're experiencing. And I do believe that if you think that your breast implants are causing depression and fatigue and tiredness, that if you take those out, you're probably going to feel better, because this sort of placebo effect and this idea really is about mind state. And so because of that, I really don't feel that breast implants have or cause illness. There's actually been no study showing that it does. However, there have been, again, many reports of patients reporting these symptoms and then removing the breast implants and getting better. So in summary, breast implants have gone over a huge evolution from a hard rock to really modernized style cohesive gel implants that are very, very safe. The debate and discussion will keep on going on. Let me know what your experience is down below.